Howdy, friends. So, I wanted to add a little bit more information from my previous video that I made about my friend who I am the medical power of attorney for here in Kansas City. This is a situation that's been going on for, a long time. I've been her MPOA for, I don't know, at least 12 years, something like that. I think that's about right, 12 or more. Um, and, she went into kind of an early stage dementia Alzheimer's situation a few years after asking me to be her medical power of attorney. So, that was a shame that it happened, but it was a good thing that she had requested that I, participate and help her in this way, which I was glad to do. But I wanted to focus for a few minutes on the hospice situation, because while there are a few different types, maybe, of a hospice, for instance, there's just your average secular hospice groups, programs. Then there's like Catholic Charities has a hospice program, which I did not even know until just a couple of months ago. And the reason that I found out about it is because I had been convinced that my friend was a candidate for hospice based on her deteriorating condition. She started out with some difficulties swallowing. And so I was reached by an outside program, meaning different organization, different business than the nursing care facility, saying that because she hit certain criteria that she was a candidate for hospice. And I listened to what they had to say, and they told me, that they had an expanded program, that hospice does more now than it used to do. I think in part that's true. I think they do provide more oversight and other maybe additional layers of care, which I won't get too much into at the moment. But it all sounded reasonable, all right, on the phone when I was contacted by them. I don't know when that was, 3 months ago, three maybe. And so I agreed to allow them to provide care. And it wasn't even, and just to be clear and to point out the fact that I'm cognizant of what hospice can be like. I told them that I in no way had any intention of them speeding up her death, that I did not want anything to change. It had to all be positive care, and they agreed that that's what they would do. But then just a few weeks in, I get a phone call from them, and I'm notified by other people who had gotten the information about my friend that she's kind of in a downward spiral, that she had not been eating, that she was not doing well with her swallow reflex. And so I get this person representing the hospice telling me on the phone that it was time to let her go, to let my friend go, and that they were going to stop feeding and hydrating her. And so I already knew exactly where I was going to take this, but I asked a few questions. And I said, so, how long would you expect her to last like that? I mean, are we talking like 24 hours? Is she really that bad that we would expect her to, to pass away within a day or two? Oh, no, no. This is going to take 2.5, 3 weeks of her lying in a bed, not being fed and not being hydrated. Okay, so I immediately fired them. And I got into it with her on the phone. I'm like, you got to be out of your mind if you think that I'm going to allow this type of thing to happen, where she's just going to be lying in a bed, pining for food and water. Um, so that's when I had to get immediately active, had her put on an IV, and then had her taken in to the hospital to get a G tube, which unfortunately at this point is no longer being used. If you saw the last video, you understand a little bit of what happened and why she's not using the G tube anymore. So, the circumstances are difficult to manage, but I want to let people know that this type of circumstance happens all the time with hospice. Now, I moved over by recommendation to Catholic Charities Hospice, and I immediately addressed the circumstances around starvation and dehydration. And they assured me that their program does not do that type of thing to any of their patients. I have no immediate reason to believe that that's anything but true, but I'm going to tell you, I'm always skeptical, because, as I've said in the past, this oftentimes comes down to individuals, not to programs, not to general rules and regs, but to individuals who may decide they want to behave one way or another. I have not seen that happen at this time, because I since have had to put my friend on the Catholic Charities Hospice program. So it's one to be aware of, should you be concerned or wary of running into other secular programs that just have no problem whatsoever shutting down a person's hydration and nutrition, once they see certain things. And, as I said, literally, they told me 2.5, 3 weeks she's going to be, around, no eating, no drinking, no nothing. Well, okay. And as I said last time, once I had the G-tube in, she was totally back in action. I mean, as far as a dementia patient can be, right? She was more with it. She was communicative. She was happy and smiling. She enjoyed a visit that I made to her with one of my sons, and was doing great. Okay, so she was not in a spiraling situation. And now I also want to update you, since my last video, that despite failing, so I'm told, despite failing her swallow test at the hospital, the one that will no longer place the G tube, she was then returned to the nursing care facility, where she has done surprisingly well. She's done better, anyway. She has been eating and she's been swallowing. Now, she's not having steak, obviously, but she is able to swallow, and so far does not seem to be aspirating. She's had many visitors over the last couple weeks, thankfully. Friends and family have been in, almost every day, if not just maybe every other day. So she's been well observed by those who care about her, and she's been hungry, and she's been swallowing, and she's been taking in some nutrition and hydration. Now the question is it enough? And I'm still pretty concerned on that front, that she may not be getting enough calories, but she's eating as much as she can, and she's doing well with it. So that's good, right? I mean, at the very least, that adds to her level of comfort. So I was a little bit more concerned, and I still am, but I was a little concerned right at the outset, the last time I made a little video about this situation, that her situation was going to be a little more dire than it seems to be at the moment. So this kind of begs questions. When is hospice really truly necessary. There obviously are times when it's clearly necessary. I'm not saying that it wouldn't be in certain cases, but when you're dealing with certain patients, dementia patients. Sorry, I'm just sitting here backing up and parking while I talk to you. You know, certain dementia patients can literally forget how to swallow. Right? They can forget how to walk. Doesn't mean they can't do it. And then that capability can come and go. And so that seems to be maybe what's happening here. But I want you to be aware that, hospice has to be scrutinized, really, truly scrutinized. You need to speak with two, three, four people involved in that program before deciding. And you need to get a good sense of what's going to go on. Now, if you're like me and you would never allow a person to be starved and dehydrated to death, then Catholic Charities is probably going to be your option when you're faced with this type of decision making for a loved one. Anyway, so I wanted to give you that just give you that quick update. Certainly make a comment or fire away with a question. I hope this is helpful. I plan on trying to do a little bit more of this generally when I'm driving, to be honest with you, because it's easier and I have the time to kind of get the thoughts out. So anyway, that's what we got for now. Appreciate you listening, and we'll talk again soon. Bye.